Hi.
Hello, my name is Lori and I'm going to be your nurse practitioner today.
Hi.
Just give me a minute, let me wash my hands. Alright, now first I'm going to have you we'll sit down. Can you tell me your name and your birthday and the day of the week?
Samantha McCullum, October 22nd, 1997, and today is Thursday. Is it not Thursday?
Yes, it's Thursday. Very good. Alright. I notice your appearance. I'm going to be talking as I do your assessment, so if you hear me say stuff, that's okay.
Okay.
Alright. I notice you are dressed nicely, you're groomed appropriately, you're clean. You are oriented, you know where you are, you know what's going on. We looked at your vital signs. Your height is 5'3". Your weight is 140 pounds. That makes your BMI 24.1, which is normal. Your vital signs, your temperature is 98.7. Your heart rate is 68. Your respirations are 16. Your blood pressure is 92/64. All of that is normal for you. So this is good. So the first thing we're going to do, as I said, I'm just going to take a look. I'm just going to feel your head. Make sure everything, you don't have any bumps, lesions, lumps. Your skin is nice and warm and dry. Proper color, beige to light pink. Your head is normocephalic, non-tender. Your hair has an equal distribution and it does feel healthy. Now I'm going to look your face. There's no scars or lesions. It's smooth to the touch. Your facial features are symmetrical. You have no temperature. Well, your temperature feels normal. You have no fever. Your temples, I'm just going to check for pulses. You have pulses up here. I'm going to listen for a minute to make sure there are no abnormalities. I hear no bruise. Now, what we're going to do is we're going to check your cranial nerves to make sure everything's intact. The first one I'm going to assess is called cranial nerve 5, your trigeminal. What I need you to do is clench your jaws. Alright, I need you to open and close your mouth. I'm checking for TMJ, temporomandibular joint. Make sure everything's okay with that. We're going to look at cranial nerve 7, your facial. I want you to smile. Raise your eyebrows. Up your cheeks. Okay. And then I'm going to what I want you to do is I'm going to show you on your arm, that's sharp and that's dull, okay? So when I touch your face, you tell me if you feel sharp or dull.
Sharp. Dull. 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 Sharp. Sharp.
I'm going to check the same on your arms while we're here.
Sharp. Dull. Sharp. Dull. Dull.
Okay. Very good. Now, everything looks fine. Your cranial nerve 7 is intact. Now we're going to check your cranial nerve 2. That's your optic nerve. We checked your visual acuity. We had you do the Snellen chart where you read the letters. Your vision was 20/20 in your right eye, 20/20 in your left eye. Now we're going to check your peripheral vision, see how you see everything from the sides. With that, I'm going to cover one eye and I'm going to wiggle my fingers and you tell me how many fingers I'm wiggling. Continue to look straight at me as we do this. How many fingers?
1, 2, 1, 2.
Okay. Now give your eyes a rest a minute. Okay. How many
1.
fingers do you see?
2, 1, 1.
Okay, very good. Now, when I looked in your eyes and you were doing it, there was no nystagmus. Your eyes are symmetrical. Now, what we're going to check are your cranial nerve 3, your oculomotor, cranial nerve 4, your trochlear, and cranial nerve 6, your abducens. That checks, I said, the nystagmus. Your eyes look symmetrical. Now I'm going to have you, when you look at me, keep your head still, but follow my finger. These are the 6 cardinal fields of vision. Very good. Now I want you to follow my finger. Convergence is good. Now I'm going to take the pen light and I'm going to check your pupils to see how big they are and how they respond. So you keep your eyes open and you look at me. This will be quick. I'm not going to blind you. All right, your pupils are 4 and equal. They react briskly. They are round. There is consensual reaction, which means when one eye constricts and dilates, the other does the same. This is good. This is normal. Your eye structure, when we looked, your cornea are nice and smooth. It's round. You do not appear to have any scratches. We're going to look with the ophthalmoscope. The ophthalmoscope. We're going to look into your eyes. As I look into your eyes, as I said, your sclera are white, conjunctiva are pink. I can see your internal vessels. There's no AV nicking. There's no cupping. Your fundus looks normal, and there's no optic edema. Now, I'm going to check your ears. Your ears look normal. There are no bumps or lumps, no tenderness. There's no drainage or redness or swelling from either ear, which is good. Now we're going to do a test, a whisper test. This tells me how you hear. I'm going to whisper a number in your ear and you repeat what I say.
21. 17.
Very good. Now we're going to check to see how the sound is. This is a Weber test. And you should feel a vibration. All right, now we're going to check for airborne conduction. Put this here. You should feel a vibration. And over here. Very good. Now, we're going to look in your ears. With the otoscope. Okay, as I look into your ear, I see there is a little bit of cerumen or wax. That is fine. Your canal is pink. I can see the eardrum. It's pearly gray. There's a positive light reflex. Let me check this ear too. Okay. Oh, sorry. And I can see the ossicles. The light position, the light reflex position is at 7 on the left and 5 o'clock on the right. Your auditory landmarks are visual or visualized. Now we're going to check your nose. I'm going to tilt your head back. I'm going to look in there. It's pink. There's no swelling, no drainage. Your septum is not deviated. I'm going to palpate your sinuses, so if you feel any pressure, you let me know. I'm checking your maxillary, your frontal maxillary. Is there any tenderness?
No.
Okay. Now we're going to check in your mouth. Let me put a glove on. Okay, so what I'm going to do is I'm going to have you open your mouth. All right, your uvula is pink and midline. There's no deviation, no swelling. Your teeth, you have no missing teeth. Your gums are nice and pink, no bleeding. Now I'm going to ask you to stick your tongue out. I'm just going to lift it up. I see no lesions. There's no hardness. I'm going to feel the roof of your mouth. All right, your hard palate is fine. There are no bumps. Let me just check it again. There are no bumps or lesions up there. Your tongue was fine. No lesions or tenderness. Your pharynx, there was nothing in the back of your throat, nice and pink, how it should be, no red bumps or anything. This is good. Your tonsils were there, they're pink. A little bit we can see them, but they look normal. This is good. Just take these off. Now we're going to check your cranial nerve 9, which is your glossopharyngeal and your vagus. So as I took them off, that's good. I'm going to have you stick your tongue out and go, ah, again. All right, your glossopharyngeal is intact. Stick your tongue out at me. Very good. You talk. Now what I want you to do is swallow. I'm just going to feel your neck as you swallow. Swallow is good. Now, I'm going to check your neck. You tell me when I feel, if anything feels tender or there's any pain. Any tenderness?
No.
Okay. I'm going to move everything first, then I'm going to listen. So I'm going to tilt your head side to side. Bend forward. Tilt it back. Any pain with that?
No.
Okay, now you can turn your head yourself. Turn it side to side. No pain. Very good. Now, I'm going to listen to your carotids. These are the arteries by your throat. We want to make sure that they're good. There's no problems. Okay, I hear no bruise, which is good. Now I'm going to palpate for your lymph nodes. We want to make sure you don't have any swelling. Your periauricle, your postauricle, your occipitals in the back, your submandibular, your submental, your tonsillars, your superficial cervical, the back of your shoulders, neck, supraclavicular. Now, I'm going to check your thyroid. And have you turn sideways a little bit so we can do this. Alright, now I'm going to have you tilt your head to the right. You're going to feel me push a little on your throat. And I'm checking the thyroid. Now I'm going to ask you to swallow. Alright, the thyroid is non-tender. There's no enlargement. No nodules fell. Now, we're going to assess your shoulders. I'm going to stand to the side. First, we're going to check for your lymph nodes. Okay, I don't feel any lymph nodes, any enlarged lymph nodes. Now, what I need you to do, all right, I'm going to inspect your shoulders are equal. This is good. They're symmetrical. All right, your lymph nodes are non-tender. Now, what I want you to do is I want you to shrug against me. Okay, very good. Now, we're going to have you shrug without me. Can you take your arm, your shoulder, and move your arm out like that to the side and then bring them in? Very good. So there's no limitations. You can raise your arms up and put them down, no problems. This is good. Now I'm going to check your elbows. The epitrochlear nodes are non-tender. Now, with your elbows, can you flex? Out. Can you turn them out like that? In, out. Very good. Now I'm going to check your arteries. Relax. Your brachials are palpable. Your radials are palpable. Ulnars, maybe. But they are +2 in regular. Now, what I want you to do is I want you to squeeze my hands. Now, I want you to try and raise your arms up against me, pushing. Very good. Now, I'm going to hold them down. You try to pull them up. Very good. Now, I need you to bend them. All right, now try and push out against me. Push me away. Okay, now pull me to you. Very good. Your strength is 5 out of 5. The next thing we're going to check is your chest. I'm going to look at it, the anterior and the posterior. It is symmetrical. The diameter is equal. I did your carotid arteries. They were fine. I could palpate them, no bruit, which is good. Now I'm going to listen to your heart. We're going to listen. This is the aortic. It's at the second intercostal. The pulmonic's at the second intercostal space. The tricuspid, the mitral, Now, what I need you to do for your maximum point of intensity, I need you to turn and lay on your left side. And we check this. This is the 5th intercostal space, midclavicular line. That is your PMI. Your heart rhythm is regular. You can sit up. Now, as I assess your lungs, I'm going to have you breathe in and out. Take deep breaths in and out. Okay, you have bronchofascicular, you have tracheobronchial breath sounds up top, bronchofascicular in the middle, and fascicular at the base. I'm going to listen to your lungs from the back, in and out. Okay, now I'm going to have you. All right, what I'm going to have you do, I'm just going to feel. I'm going to percuss. Now, can you tell me as I feel your lungs, can you say E?
E.
Can you say 99?
99.
That's egophony and bronchophony. That is normal. So now I'm going to have you lay down. I want to check your abdomen. Okay, we want to undress you all the way. I promise. There are no scars. It's flat. I'm going to take a listen. Make sure you have vowel sounds, which means your intestines are moving. All right, you do have vowel sounds. So what we're going to do is I'm going to listen to your arteries real quick while I'm listening to everything. These are the arteries for your kidneys. That's the arteries for your legs. Right here, no bruise. Now I'm going to tap. I feel dullness, which is normal. Now you're going to feel me press on you. We press to see on the right side. I do not feel the edge of the pancreas, of the liver. You can also feel. And then over here, checking for the spleen, I do not feel the edge of the spleen. While we're here, we're going to check your bladder. Do you have any pressure when I press?
No.
Okay, this is good. Now I'm going to check your aorta, which is what we want to see what it is. It is right here, and the normal for the aorta is 3 centimeters. Okay, so I'm going to go ahead. I'm going to have you sit up. I'm going to swap back sides here. Okay, now we're going to look at your legs. I see no swelling, no edema. I'm going to check your pulses, your pedal, your dorsalis pedis, your popliteal. They're palpable, which is good. That means you got good circulation. Your feet are pink. They're not changing color or anything like that. This is good. And I need you to point your feet, flex your feet. Can you move them in circles? Very good. So you have normal range of motion. Everything is good. Now what I'm going to check your deep tendon reflexes. we're going to do is have you hold your arm up, down, there's your biceps, triceps, brachioradialis. We're going to check your patellar, your Achilles, now what I'm going to say, I'm going to pick it up. Now this is going to, I'm checking to see. This is called a Babinski. It just lets me know that your nerves are intact, which it is. Now, I'm going to have you hold some objects in your hand and I want you to tell me what they are. We're checking for stereogenesis. What is that?
Key.
Okay, close your eyes. What is that?
A quarter.
Okay, and this?
A seam ripper.
And this?
A key.
Very good. Now, we're going to do the point. I'm going to have you take your finger. You're going to touch my finger, touch your nose. Keep your head still, but you're going to follow my finger and do it. Okay, so touch my finger, touch your nose. Very good. Now, we're going to assess your lower extremities. I need you to tap your feet on the floor. Tap one fast, then tap the other. All right, now we're going to have you stand up. We're going to check your spine and your drift. All right, now if I push you back, you can bend back, you can lean forward, you can lean to the right, lean to the left. No, we're not going to dance. All right, I want you to walk heel to toe. Okay, and turn around and come back. All right, you can go ahead and sit down. Now what I need you to do, this is called pronator drift. What we're checking for is to make sure that your brain is working properly. I want you to hold your arms out in front of you, turn your palms up to the ceiling. I want you to close your eyes to the count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, now while we're here, I want you to push up, push down. I want you to pull me to you, and I want you to push me away. Very good. Now the next thing we're going to do is I am going to have you stand up one more time for your balance. Close your eyes. And if I move you, let's see if you can hold your balance. Don't fall back on me. All right, that is the Romberg test, which you passed, which means your balance is good. This means your brain is working properly. Everything is working how it should be.
Okay.
A couple questions. You can have a seat. A couple questions I need to ask. Do you do your self-breast exams every month?
Yes.
All right. Do you see an OBGYN or whatever for your periods? Your periods have been regular. You see the doctor to get checked and all that,
Yes.
correct? Okay. That's why we did not check those. So everything looks good. Your assessment is good. Your vital signs are good. And you get a clean bill of